Hello, I'm Dr. Park, one of the pediatric dentists at Broad Smiles. This video is for our patients who just had their dental extractions done in our office. This is just some instructions for how to manage your child after he or she had a dental extraction done in our office. So typically, based on what type of local anesthetic was used to numb the area, the child will be numb anywhere from 1 hour up to 3 or 4 hours. The most important thing when a child has a tooth extracted is to stop the bleeding as soon as you can. What we give the child is a couple of gauzes to make sure the child can bite down on it. What you want to do, you want to fold it up probably twice and then turn that into a little ball size, little wad. You're not chewing on it like a piece of gum and bite on it for 15-20 minutes. While the child is numb, it is also strongly recommended that you give the child something to manage the pain once the numbness wears off. Typical recommendations would be Tylenol or ibuprofen, also known as Motrin. Sometimes if the pain is moderate, most things can be managed by alternating between Tylenol and Motrin. What I usually recommend before the numbness wears off, having a dose of Tylenol or Motrin. Food-wise, we want to avoid anything that may cause bleeding, may irritate the area, and give discomfort later on. So typically we're talking soft foods. My favorite is always ice cream, and anything like that that's soft, bland, and does not have any crunchy parts would be best. Other foods that are also good, things like mashed potatoes, soft pasta, yogurt, pudding, things that we want to avoid, anything that's really crunchy. So think of things like chips, also things with small particles like strawberries, poppy seeds on bagels, everything bagel, things like that. Those things may lodged in where the teeth used to be and possibly delay healing in that area. Drinking wise, we want to make sure the child is hydrated. But at the same time, we want to make sure we're not doing anything that may cause the area to bleed again. And generally speaking, we want to avoid any negative pressure, anything that causes sort of a fish face motion. You can always think that can cause a bleeding again. So devices such as a sippy cup or just a regular bottle or straw or anything like a pacifier. So if they're having a regular beverage, just drink straight from the cup. Or if the child is having a difficult time or does not know how to drink from a cup yet, I would advise using a spoon. Now, it may be advisable, especially if your child had some permanent teeth extracted because of braces. There may be more expected bleeding, and oftentimes the bleeding is pretty minimal, but then because of our saliva, it can look a lot worse. So at bedtime, I usually recommend propping their head up a little bit, maybe a couple of pillows, and also putting a little towel or something over the pillowcase or pillow to make sure if there's any oozing or drooling, but it doesn't damage our pillowcases. Now, let's say your child has had any dental extraction done at our office, and then later on, let's say if it's at 3 p.m. and 6 p.m. and 7 p.m. at dinner time, there's continuous oozing, pretty active bleeding that cannot be managed. I would really recommend that you give us a call right away. And when you call our office phone number, there will be an option to contact our doctor on call to guide you through a potentially scary situation. Now, in the very slim chance that you cannot get through to us, I would definitely recommend using the gauzes we give you and putting firm pressure for at least 20 minutes or so. The child may need your help to hold the gauze down. I would always advise contacting us first so that we can guide you. Or worst case scenario, I would recommend visiting an emergency room to make sure that can be managed.